And what do you do if the glasses don't work?
That's always the next question. So there's a few things. So if the glasses don't work, then we can use surgery to straighten the eyes. Sometimes it's that they haven't been in a fully relaxed state when we do the eye drops. So often we'll repeat the eye drop exam with stronger dilating drops, make sure that we've got the full correction in their glasses. But about 2/3 of the time, the glasses will fully correct the turn, at least for the distance. And if they don't fully correct the turn and there's still a little turn for up close, for it near, that's actually not a problem for visual development. Some ophthalmologists would put in a bifocal ad, but actually the evidence that's coming out doesn't make too much difference long term to your visual development.
Right.
So generally, unless there's a really good reason to use bifocal glasses, I don't tend to do it.
Right. Cool. That's great. And what can happen if you don't treat it? If you just leave it, what are the risks of that?
Yeah, so some kids do pretty well actually, and then if they don't have glasses, they will be always cross-eyed though, so
Right.
it might be noticed by friends and family that they're always cross-eyed. If they switch eyes, and sometimes they're looking out of their left eye and sometimes they're looking out of their right eye, then both eyes can still develop good visual pathways and good visual development in the brain. But what can also happen is that one eye is their dominant eye, usually because it requires less prescription than the other eye. So it's a slightly stronger eye to start with. This eye's a little bit blurry. The brain's now got double vision, so it needs to pick an eye to ignore, and it ignores one eye all the time. And that eye ends up turning inwards and not developing the visual pathways.
Right.
And that's when you get what's called a lazy eye or an amblyopic eye. And so that's when we might instigate some patching. And so we'd put glasses first, because sometimes just the glasses will straighten the eye and then that will be enough to correct the vision. But if that eye really isn't learning to see properly, then we have to start doing patching so that we switch the fixation and force the weaker eye to do some work.
Right.
Learn to see properly.
Right.
And the important thing about that is we've got a sensitive period of visual development. And by the time you're 7 or 8, basically your brain pathways for vision have locked in. So the earlier we treat kids, the better. But certainly after the age of 8, it gets really hard to treat amblyopia. And so that eye may not see well for the whole rest of your life.
Wow. Okay.